Hi, welcome back to another episode of MedScore Radio. I am reading the summaries from QBanks in order to help me memorize or understand the key points from these questions. So let's get right back to it. Okay, first let's talk about pulmonary hypertension. Pulmonary hypertension should be suspected in young and otherwise healthy patients with fatigue, progressive dyspnea, atypical chest pain, or unexplained syncope. Long-standing pulmonary hypertension leads to hypertrophy and or dilation of the right ventricle, which is cor pulmonale. Okay, moving on. Let's talk about sick sinus syndrome. Sick sinus syndrome results from degeneration, usually age-related, of the sinoatrial node, leading to impaired conduction and reduced cardiac output with symptoms of dyspnea, fatigue, lightheadedness, pre-syncope, and syncope. ECG typically demonstrates bradycardia with sinus pauses or delayed P waves, sinus arrest, dropped P waves, and junctional escape beats. Most of the cutaneous lymph from the umbilicus down, including the anus below the dentate line, drains to the superficial inguinal lymph nodes. Exceptions are the glans penis and posterior calf, which drain to the deep inguinal nodes. X inactivation occurs in genetically normal females and results in conversion of the inactivated X chromosome into compact heterochromatin, which is a bar body. Heterochromatin is condensed chromatin composed of heavily methylated DNA in tight association with deacetylated histones. It has a low level of transcriptional activity. In contrast, euchromatin is loosely arranged and exhibits a high level of transcriptional activity. Increased blood oxygen saturation between two right-sided vessels or chambers indicates the presence of a left-to-right shunt. If the abnormal oxygen increase occurs between the right atrium and the right ventricle, a ventricular septal defect, or VSD, is likely present. Small VSDs produce a holosystolic murmur that is loudest over the lower left sternal border. Congenital long QT syndrome is commonly caused by a mutation that slows the delayed rectifier potassium current that repolarizes the cardiomyocyte action potential. Certain medications, for example macrolide antibiotics, antipsychotics, and antiemetics, also slow the potassium repolarization current and prolong this QT interval. Excessive QT prolongation can trigger serious cardiac arrhythmia, for example, torsades de pointes, resulting in syncope or sudden cardiac death. Pyruvate kinase deficiency causes hemolytic anemia due to failure of glycolysis and resultant failure to generate sufficient ATP to maintain erythrocyte structure. In this case, splenic hyperplasia results from increased work of the splenic parenchyma, which must remove these deformed erythrocytes from the circulation. So that was pyruvate kinase deficiency. Infection with Mycoplasma pneumoniae can result in the formation of cold agglutinins, which are IgM antibodies primarily, that bind red blood cells and cause clumping or agglutinations at low body temperatures. Other illnesses resulting in cold agglutinin formation include infectious mononucleosis and certain hematologic malignancies. And moving on, let's talk about myocardial oxygen extraction. Myocardial oxygen extraction exceeds that of any other tissue or organ. Therefore, the cardiac venous blood in the coronary sinus is the most deoxygenated blood in the body. Due to the high degree of oxygen extraction, increases in the myocardial oxygen demand can only be met by an increase in coronary blood flow. Let's talk about hypertrophic cardiomyopathy. Many patients with hypertrophic cardiomyopathy have poor cardiac reserve, for example, exercise intolerance, due to left ventricular outflow tract obstruction. This outflow obstruction is worsened by decreased left ventricular blood volume. Beta blockers decrease heart rate and left ventricular contractility to increase left blood volume, reduce left ventricular outflow tract obstruction, and improve the symptoms. Torsades de Pointes, or TDP, refers to polymorphic ventricular tachycardia that occurs in the setting of a congenital or acquired prolonged QT interval. TDP is most commonly precipitated by medications that prolong the QT interval, such as certain antiarrhythmics, for example, sotalol or quinidine, antipsychotics, haloperidol, and antibiotics, such as macrolides and fluoroquinolones. Intermittent explosive disorder is characterized by recurrent episodes of explosive verbal or physical aggression. The aggressive behaviors are impulsive and grossly out of proportion to the provocation. Staph saprophyticus is responsible for almost half of all UTIs in sexually active young women. Staphylococcus saprophyticus belongs to coagulase-negative staphylococci and is unique among these because it is resistant to novobiocin. Let's talk about familial hypercholesterolemia. One of the most common autosomal dominant disorders is the result of heterozygous or homozygous LDL receptor gene mutations which cause hepatocyte underexpression of functional LDL receptors. This condition can lead to accelerated atherosclerosis and early onset coronary artery disease. Let's talk about brown pigment gallstones. Brown pigment gallstones are composed of calcium salts of unconjugated bilirubin and arise secondary to bacterial or helminthic infection of the biliary tract. Beta-glucuronidase released by injured hepatocytes and bacteria hydrolyzes bilirubin glucuronides to unconjugated bilirubin. The liver fluke Clonorchis sinensis has a high prevalence in East Asian countries and is a common cause of pigment stones. So as with the other questions you're seeing in these question banks, you have to remember these small points so that you can recognize them on the test. It's not often that you're going to be asked a typical case, so what you might think of as small points could actually be very important points, but they're easily missed. Okay, let's move on as we continue to go through these. Phenoxybenzamine is an irreversible alpha-1 and alpha-2 adrenergic antagonist that effectively reduces the arterial vasoconstriction induced by norepinephrine. Because phenoxybenzamine is an irreversible antagonist, even very high concentrations of norepinephrine, such as those seen in pheochromocytoma, cannot overcome its effects. So remember that phenoxybenzamine is an irreversible alpha-1 and alpha-2 adrenergic antagonist that reduces arterial vasoconstriction induced by norepinephrine. Both perfusion and ventilation are highest in the base of the lung and lowest in the apex. However, the variability in perfusion is greater than that in ventilation. This causes the ventilation-perfusion ratio to follow the opposite gradient. It is lowest in the base and highest in the apex. Most gastric ulcers arise along the lesser curvature of the stomach, usually at the transitional zone between the gastric corpus or body and the antrum. The left and right gastric arteries run along the lesser curvature and are likely to be penetrated by ulcers, causing gastric bleeding. Okay, a radioimmunoassay uses specific antibodies and a fixed quantity of radio-labeled antigen to determine the amount of antigen present in an unknown sample. This is done by measuring the amount of radio-labeled antigen displaced from the antibodies in the system. Let's talk about Chagas disease. Chagas disease is a protozoal illness that is endemic to Latin America. Patients in rural areas are at greatest risk when their houses harbor the vector, which is called the triatome bug, in adobe walls or thatched roofs. Acute infections are often asymptomatic, but patients can develop Chagas cardiomyopathy, for example, heart failure, ventricular arrhythmias, and ventricular aneurysms several decades later. And now it's time to talk about dermatomyositis, which is characterized by proximal muscle weakness resembling polymyositis, with additional inflammatory features involving the skin, heliotrope rash, or Gotron papules. Both dermatomyositis and polymyositis may occur alone or as a paraneoplastic syndrome associated with an underlying adenocarcinoma, for example, ovary, lung, or pancreas. Retinal artery occlusion is a cause of acute, painless, monocular vision loss. It is usually caused by thromboembolic complications of atherosclerosis traveling from the internal carotid artery and through the ophthalmic artery. Okay, this one says, providing informal treatment to friends is ethically problematic for physicians and should generally be limited to emergency situations in which no other physician is available. Pulsus paradoxus. This is defined by a decrease in systolic blood pressure of greater than 10 millimeters of mercury with inspiration. It is most commonly seen in patients with cardiac tamponade, but can also occur in severe asthma, chronic obstructive pulmonary disease, and constrictive pericarditis. Giardia lamblia is the most common enteric parasite in the United States and Canada and is a common cause of diarrhea in campers and hikers. Iodine-stained stool smear classically shows pear-shaped flagellated trophozoites or ellipsoidal cysts with smooth, well-defined walls. and 2+ nuclei. Metronidazole is the treatment of choice. Okay, remember that dystrophic calcification occurs in damaged or necrotic tissue in the setting of normal calcium levels. Metastatic calcification occurs in normal tissue in the setting of hypercalcemia. Atherosclerosis is initiated by repetitive endothelial cell injury, which leads to a chronic inflammatory state in the underlying intima of large elastic arteries, as well as in large and medium-sized muscular arteries. Norepinephrine stimulates cardiac beta-1 adrenoreceptors, which increases cAMP concentration within cardiac myocytes and leads to increased contractility, conduction, and heart rate. Peripheral vasoconstriction occurs via stimulation of alpha-1 adrenoreceptors in vascular smooth muscle cells and activation of an IP3 signaling pathway. Let's talk about interferons, alpha and beta. Interferons alpha and beta are produced by most human cells in response to viral infections. The production of alpha and beta interferons helps suppress viral replication by halting protein synthesis and promoting apoptosis of infected cells, limiting the ability of viruses to spread through the tissues. Hepatitis D virus, or HDV, is a replication defective RNA virus that is capable of causing infection only in the setting of co-infection with hepatitis B virus, or HBV. HBV provides hepatitis B surface antigen for the HDV envelope. On posterior anterior chest X-ray, the right middle lobe is seen adjacent to the right border of the heart, which is primarily formed by the right atrium. Consolidation in the right middle lobe can obscure the X-ray silhouette of the right heart border. A Mallory-Weiss tear is a tear in the gastric mucosa near the gastroesophageal junction. It typically results from repetitive forceful vomiting, which can also cause metabolic alkalosis.